Let's talk.
And here's your host, Henry Benefield.
Hello, everybody. Welcome to another exciting program of Let's Talk. As you can visually see, I'm your host, Henry Benefield. It's always good to have you come back to visit us again. Listen, we've been talking about a lot of stuff in the past shows, and I want to thank everybody for the interest, on some of the topics we've been talking about. What we try to do is bring informational programs where we have different guests to get, different perspectives and information to assist you in your daily lives and whatever you do. I tell you, we're just excited to be on this program. Want to thank everybody for helping to produce the program, as well as all the people that help to make the program a reality. So listen, let me give you a couple of dates just to make you aware of what's going to be going on. On December the 8th, I'm getting a little tongue-tied here. On December the 8th, the 100 Plus African American Men's Course is going to be doing their annual benefit concert. It's going to take place at the Allen Temple AME Church, 7080 Reading Road. That's right on the corner of Seymour and Reading Road. And we'd like for you all to come out and support those men. Of course, they go to expound on inspiring and educating young African-American youth to be the best that they could be. That's going to take place at 5 p.m. Again, that date is December the 8th. That is the second Sunday in December. We certainly do expect to see you there, having special guests to come and join us as well. Again, one more time, December the 8th, Allen Temple AME Church, 5 p.m. in the afternoon. The 100 Plus African American Men's Course will be in concert. Okay, so listen, not last month, but a couple of months ago, we had a show where we talked about insurance such as Medicare, Medicaid. There was a lot of excitement that was stirred up in reference to it because people really wanted to have information about it. Let me just let you know that next month, we're going to do a very, very special program on that with information. Some changes are taking place, and we didn't want to have a broader show until we got all those things in place to inform you specifically what is going on. The reason we're having these kind of shows is because as we meet our general public, we're finding that people just do not know and are confused as to what to and what not to do. So we're providing information for you to make good choices, to support what you're doing in your lives and stuff like that. So I'm going to proceed further. We're going to talk a little bit more on this insurance, things like Medicaid, Medicare, and what we've done is taken the liberty to invite a very qualified guest to be answering some of the questions, just to expound on some of the things that you might be thinking about. She is an insurance specialist. She works with the Crossroad agencies, and she does this every day, dealing with a lot of people in this category, and we're just so proud to have her here. You've seen her on the show before. She's hosted for me when I was either out of town or something like that, but she's always been a wonderful host, and it's good to have her back as a guest today. So, ladies and gentlemen, please welcome my very, very good friend. Her name is Mrs. Leslie Calhoun, insurance specialist from Crossroads. Miss Leslie, welcome to the program.
Thank you for inviting me.
It is such a pleasure to have you here. We decided to do this because, so many people are just confused. I mean, they really don't know, not necessarily everything, but just some of the basic stuff, that's involved insurances, whether it's Medicaid, Medicare, Plan B. And sometimes it can be overwhelming. Tell me some of the things that you have found. You work with this insurance part every day. What are some of the things that you've experienced when it comes to dealing with some of the clients you've dealt with?
As far as what, the Medicare or?
It could be any. It could be Medicaid. It could be Medicare. But because I'm sure there's so many questions, whether it's in Medicaid, Medicare, or just like, I know you work with people, the marketplace as well, correct? Mm-hmm. So, let's just talk about what are some of the things you experienced that, probably can help people with.
Well, first of all, there's three different plans. We have Medicaid, that usually deals with individuals' economic levels. Then there's Medicare, deals with individuals usually that are 65 or older, or individuals who get Social Security disability. Mm-hmm. And then there's the Marketplace, which is the insurance for individuals who work, but their jobs don't offer them the essential benefits.
Sure.
So they go to the marketplace and purchase a plan.
Sure.
So you have those three different ones.
Wow, wow. Now, when I know the marketplace, as we call it, Obamacare, I know there have been several changes that have been done in reference to legal things that have taken place, but people can still get it. Is that correct?
When the open enrollment begins for the marketplace, that's not until December. For the marketplace, yeah, the healthcare.gov marketplace is where individuals go who are working. They make too much to receive Medicaid. They're not old enough on some instances to get Medicare. So they have the plan. They can go to the marketplace where the government helps pay for some of the plan, helps pay for part of the premiums, and also some of what they call the cost share reductions, the co-insurances, the co-pays. So that's what the marketplace is. And then the Medicaid is normally for individuals, like I said, who have low income. Used to be that the Medicaid was primarily for mothers with children. But now, since Ohio was one of the states that expanded Medicaid, so now it's open up for any individual. If they're single, if they make less than $1,400 a month, they're eligible to get this state-assisted insurance, which is called Medicaid.
Wow. So you have individuals that have to make less than $14,000 a year?
$1,400 a month.
$14 a month.
If they're one person, their household, they are eligible for Medicaid.
Wow.
And it goes upon the scale, household of 1, household of 2, up to household of 8. So there is a federal poverty level guideline, and that based upon that amount, the individual, if they qualify, they're eligible to get this insurance.
So, and then when you start thinking of people making basic, $8, $7 an hour, that certainly is under $1,400 a month.
Yeah, but the tricky part about it is an individual who makes $9 or $9.50 and works 40 hours would not be eligible.
Okay. Because
that puts them over. So it's really a small amount of money that you can make in order to get this Medicaid.
Wow. Wow.
And then that leads them on to the marketplace if they're eligible.
Do you know what the actual age would be? Would they have to be 18?
In order to get Medicaid as a single individual, you had to be 19, age 19 to age 64.
Wow, wow.
And so children under the age of 19 in their household, in their family's household, are eligible if their parents fall into that financial guideline.
Sure. So if an individual is either disabled and not able to work, for instance, and not necessarily receiving an income or something, but is not able to work at that time and may be receiving maybe public assistance or something, is it possible that they could qualify for Medicaid?
Medicaid,
yes,
right, yes. And most times those people who are disabled, they're probably getting Social Security as well, some type of Social Security income. But if a person is not working or they're not making enough, making more than what the guidelines is, they're eligible for the Medicaid. That's what a lot of people don't know.
Right.
Zero income up to $1,496 a month, that individual is eligible to receive state-assisted insurance, which is Medicaid.
So if we hear of a lot of people are homeless. And the simple fact that I think one of the concerns is for them to have health care, but first would be to have a home, I'm sure. But the simple fact in that current position, with zero income, being homeless, they could actually still yet have Medicaid?
Absolutely.
Wow. Wow.
And then there are agencies in the city, for example, down on 117 East 12th Street, there's an agency that people can get their mail sent to. The Homeless Coalition, right there on 12th and the corner in between Vine and Ray Street. There's 117 East 12th Street. They can go, it's called the Homeless Coalition. They can get their mail sent there. So they can be in a facility, some types, city gospel mission or not necessarily having a home where they put their own key in the door, but there are agencies that accept them.
Wow. And I think this is really interesting because when you think of a lot of people that are totally unaware that they could actually have some medical coverage, such as Medicaid, and the information of how do I get this, and let's talk before we go to talking about how to get it. Let's talk about some of the things that Medicaid. We're not talking about Medicare, but Medicaid. What does that do for an individual that may be homeless and has no availability to any medical treatment anywhere? What does that do for a person?
Well, it gives them coverage. It gives them health coverage.
Okay.
And with health coverage, it allows them to go to it. There's a provider, a doctor, that accepts Medicaid. They have themselves a primary care physician.
Okay.
So they have someone that they can see on a regular basis and they get covered. They have access to getting their medications.
Wow.
They have access to go to the hospital or the urgent care. They have access to some times they might have to see a specialist. Some specialists may accept it. Dentist work, vision, they can get all of that.
Wow, wow.
If that provider is one who accepts state Medicaid, then they can be seen with that, the health insurance.
Wow. And I think that's interesting because, again, when we're dealing with people who have either not a large income or have zero income, one of the issues is some of the things that are available to them in that situation. And it's good to know that things like Medicaid would cover things like you say, eyeglasses or I don't know, does it cover dental?
Yeah, absolutely.
Wow. Now,
but it would have to be a facility, a doctor or a dentist that accepts Medicaid through the state. Yeah, but there's plenty of them in the city. It's just a matter of them finding out who they are, and that, you know, there's agencies that help them find those providers.
Sure.
But it has been. This is what the Affordable Care Act did.
Okay.
It allowed individuals who are single or multi-family members, if they fall up under a certain amount of income, they're eligible to get this. And so many people don't know. It's still hundreds and hundreds and hundreds of people who are eligible to get this coverage, but they have not.
Wow. And then for the simple fact they don't go to the hospital for possible preventive measure because of the fear of not having some kind of insurance.
And a lot of people were using the hospital, the emergency room, as a primary care. So they'd go, they didn't have a doctor, but they'd go to the emergency room, especially places like University of Cincinnati where they can't usually turn anybody away.
Sure.
You know, so it's also, it's just good to know that that we make it educate people to know that they're eligible to get this coverage.
Wow, how awesome. And this, it sounds almost like amazingly wonderful for somebody who is in a position that may be in transition between, I mean, does it go for a certain period when they qualify for it for a certain period and then they have to recertify?
Yeah. Well, there's options.
Okay.
There's options that they can tell the state that the state can automatically recertify them at every 2 years, or every 3 years. But most people recertify yearly, annually.
Okay.
And that's just to verify that their address is the same, that their income has not changed, that the household status is still the same. But there is a verification process, and that oftentimes, with the population that receives Medicaid, they get kicked off, so to speak, of the Medicaid because they failed to recertify. Maybe they moved and they haven't gotten their mail and they haven't checked in to see what was going on. So they lose it, but then now they can always reapply. It's just a period of time. It used to be 30 to 40 days that the process the processing of an application, a Medicaid application, but now, because of the overwhelming amount of work, individuals, it might take 45 to 60 days to
wow.
get the Medicaid certified. But there's other things in place to cover them in that wait process too.
Well, I know we can never ever say cost. Would you have any information in reference to cost for someone receiving? Not prices, I know everything's different. I mean, traditionally, is there like a 5%, 10%?
Not with Medicaid.
Okay.
Medicaid is a free insurance.
Wow.
It doesn't cost the individual anything.
Absolutely nothing?
It's absolutely nothing. It's
wow.
all sponsored by the state.
They just have to qualify.
Yeah, they just have to qualify.
Wow.
But let me be very clear. Things may change with the administration and the different things that are going on where this may not be a benefit for long.
Wow.
And there might be some additional things that may happen. For example, it may come down that in order for a person to receive Medicaid going forward and they're eligible, they might have to show that they're working or doing some volunteer work. Mm-hmm. There's some things that might happen. That's why we urge everyone, if possible, make your what is the word I want to use? Utilize your rights and vote mm-hmm. for people that will support.
Make your voice be heard.
Will support the Medicaid and continue to allow individuals who are low income to be able to receive it.
Wow, how awesome, how awesome. So if a person is listening to our program, which I'm sure they are listening to the program, and they particularly wanted to be able to find out more information about Medicaid, I know that they could possibly call you, but aren't there also additional numbers where they can?
Most people have access to the internet.
Okay.
And they go to Google, mm-hmm. and they all they would need to do is Google Ohio Medicaid. Wow. And it would come up ohio.benefits.gov, ohio.benefits.gov, which will give them the website for Ohio Medicaid. They can put their application online.
Oh wow, they can do it online.
They can put they can put the application online. Individuals who are already receiving Medicaid and just need to recertify or mm-hmm. renew, mm-hmm. they can call. There's a number, a toll-free number that they can call, and once they follow all the prompts, can speak to a representative that will renew them over the phone.
Wow.
They can also go to the location here in Hamilton County mm-hmm. at 222 East Central Parkway mm-hmm. and turn in requested documents or speak to a case manager or a caseworker.
Sure.
So there's several different ways that a person can become enrolled in
wow.
Medicaid.
Wow, how awesome, how awesome. And I'm hoping that everybody got the information that Ms. Calhoun has been speaking about, because certainly in today's situation, there are options available for people that may possibly be in a low-income situation where you can have insurance, such as Medicaid, and hopefully, again, that you've written that information down or remember that information to be able to follow up on that. But I wanted to ask Ms. Calhoun, the last time, I think a couple of months ago, we did the program, and we were talking about different things like Medicare, and she clearly defined the difference between Medicare and Medicaid. And if you wanted to expound on it, we're going to go into a clip. It was so good. You guys asked us so much information to go back over again some of the information that was provided on the previous taping. We're going to show some clips for that. Also, we're going to have, as I said earlier, we're going to have a continuation in November for the new things that have been implemented. I'm sorry, I said
in October.
October, yes, ma'am. What did I say, November?
Mm-hmm.
I do apologize, ma'am. October, thank God for the smart people in the program. Mm-hmm. So in October, we're going to have another program on that to make sure you guys get all this information as well. But did you want to expound upon it a little bit, Ms. Calhoun?
Well, before we moved on, I wanted to make sure that the people knew The number for Ohio Medicaid, they can call. And that number is 866-640-6446, Ohio Medicaid. And they can call that number and follow the prompts. They'll say if you're calling for food assistance or cash assistance or Medicaid at this number. But you follow the prompt until you find and you can speak to someone and they can give you all the information that you need. Those are individuals that are directly in the Department of Medicaid.
Can you give the number one more time, please?
Okay, it's 866-640-6446. That's the Ohio Medicaid number.
Awesome.
Most people know about the 946-1000. That's the local number for Down and Jobs and Family Services. But the unfortunate thing about that, individuals who call that number are usually individuals who have a minute phones, AKA the Obama phones that are only giving like 250 minutes a month or however works. And you might be on the phone for that long waiting for someone to answer. So unfortunately, it's easier that if you can find somebody that has a landline or an unlimited phone to call those numbers and get somebody to answer them.
We did the previous show. You were a guest on the show. Would you like to set the clip up and explain a little bit where we're going to transcend to in reference to our guests, because they've done such a good job of finding pertinent information to be able to share again with our audience?
Well, I believe we're going to be talking with Robert Renfro, and he is an independent agent, insurance agent. He will also be the one that will be back with us in October, bringing out some more things that are happening in the Medicare private insurance industry. So it's basically, I don't know exactly where we're going to go into this clip, but he's going to be talking about the different things, explaining the different portions of the Medicare, different things that are involved with the enrollment process, because Medicare open enrollment will be starting October the 15th. And it will be ending in December. That is where individuals who have the red, white, and blue card, Part A and Part B, can elect to get into the managed care portion, which is the Medicare Advantage, which is known as Part C. So he's going to be expounding upon that in this clip and possibly give some other information. Don't know exactly where our producer is going to start it at, but we'll see. And
I think one of the things that is so important, because he starts going over the different components of Medicare. You hear people A, B, C, D, and let's talk. That can be so overwhelming for some people that have never had to deal with this kind of a situation before, because to them, they see B, but it entails such an intricate outline of information and coverage. I'm sorry, go ahead.
Well, what he shared was, and in the clip, and I don't know if this is going to show in this particular clip, but at age 65, individuals who have worked 10 years or so, I believe he said, automatically get enrolled in Part A. Part A of the Medicare just covers the facility, the hospital, the stay in the hospital. And then you have Part B, which is the part that covers the providers, the doctors. Then you have Part C, which is to include Part A, Part B, and normally it includes prescriptions. And sometimes that Part C might also cover preventive care, vision, and dental. And so that's checkups and those types of things.
Wow, awesome. Well, let's go and check this clip out. I hope you guys still have your pens and pieces of paper to get the information from Mr. Robert Renfro as we go to this clip. And we'll come right back before we go out of here and get more information for you. Let's take a listen to the clip, everybody.
But I'm saying in case you have questions, so that when you finally make that call, you have all the
So I'm finding people, when they get to that point, they have no clue.
Right. And then also, now, it's not only 65. This is what you have to really be careful about saying. People, if they get Social Security disability, they're connected. They have to be in touch with the Social Security Department. So the 65 is what has been the normal, the normal mode.
Sure.
But if you're getting Social Security disability, you're automatically enrolled into Medicare.
Okay.
And so, you know, there's a lot of questions, but there's a lot of help. But to come to a point that you said earlier, the television commercials that you see, call this number. Do you want to join the silver sneakers? And do you want to have these things? And do you want to have that? And what happens is that a lot of our people who are getting Medicare and they're already enrolled in a plan, they see these advertisements, they call these people, and they change their plans, and the person on the other end may not have, you find this to be true, might not have checked to find out, are their doctors partnered, or we call that
in their network.
In their network, are their medications covered? And they make these decisions. And the unfortunate thing is predatory, but it ain't illegal.
So, I'm sorry. Go ahead. Please continue.
So we just suggest that, and I tell all the people all the clients that I work with, before you make any decisions, you call somebody.
And that's why we're having the show. That's so we can go over. We don't have the 5 hours to do it.
Yeah.
That we can go over what you should be aware of before you make any final decision.
Yeah, because what had happened, it used to be, and I was sharing this with Robert a few weeks ago, it used to be that a person who has Medicare, but they get this extra help, they were able to change their plan every month. So if something happened and, I don't like this plan and I want to go to another plan and my doctors are covered, I can change once a month. Now the government has changed it. You can only change once a quarter. So that cuts it down and it makes it so much more difficult.
So that we're not leaving our audience, let's divert back just a little bit and go back to the A, B, C, and D, because you're aware of plans, but they may not understand, where do these plans apply, these coverages apply. You mentioned A, what it covers. You mentioned B, where it covers. You mentioned C. You mentioned D. Let's go back to, what are the options in choosing something that's going to serve you in the Medicare, and at what point do you have to make decisions?
Yeah, and they're not plans.
Okay.
So parts or plans?
No, they're not plans.
Ma'am, I understand that.
Okay.
I'm just trying to get to the coverage and getting information to the people where, when they make choices on the correct name of the what they have to choose, what are their options? What should they be looking for?
Okay, with respect to Medicare, there are two options. So we can say they have to go down two roads. They have to pick one or the other. The first option is the A and B, the red, white, and blue card. As we mentioned again, A is for hospital and B is for medical. But since that only covers 80%, if they're down this road, they also need to pick a prescription drug plan, Part D. The average cost of that is $35 for Part D if they go down this option. Now, they need to cover that 20%, so they would need either a Medicare supplement plan, or if they're on full Medicaid, it's going to pick up at 20%, or if they're still working, their employee can pick up at 20%. So if they go down that road, they basically need 3 cards. They need the red, white, and blue card, they need a prescription drug card, and they need a supplement or another coverage. Now, that's option 1 for Medicare. Option 2 is Part C, Medicare Advantage. It's all in one. So it basically includes all of that.
So what are the options? Would that automatically be assigned to a person, or would a person have to make a decision to choose that? Option C.
A good question. They have to make they have to make a decision. They have to make a decision to enroll.
Wow.
Yeah, they have to, unless they take their Social Security early, which they'll be automatically enrolled in Medicare come 65.
Sure.
Yeah, but if they haven't taken it, they have to make it. They have to take action. They have to take the initiative.
Wow.
And if they don't,
and as Ms. Calhoun just indicated, there are time spans in order to do it.
yeah, I recommend that people who are turning 65, and I advise a lot of people over 65 too, because they need to review their plans at least once a year because they change. They automatically renew, but they still should review them to make sure that their doctors are still in the network, and that their medications, each plan has a different medication list, that their key medication hasn't been taken from that list.
And see, this is what's interesting, because a person will assume that if I chose this particular plan, it's consistent as long as I have it, rather than an annual review to make sure it still has what I need for me as a person, my personal health. Because you said a doctor may not be in that plan. If you don't review it, you may not know it.
Right.
So I'm sorry, please.
Yeah, well, yeah, doctor can come in and out of the network.
Wow.
So then I was talking about option two. Option two, Medicare Advantage, that's what you primarily see on TV, because you'll see advertised zero premium plans. So people would ask me, and they may have asked Ms. Calhoun, how can it be a zero premium plan for me to get coverage? The reason it can be is because our government pays these insurance companies $800 or $900 per month for enrolling. And that's why people turning 65 get so much mail, because these companies want to see if you want to change to them so they can get that $800 or $900 a month.
So as an individual, and there are many people with different health conditions and so much stuff, as an individual, what are some of the points they should be looking for when it comes to choosing some of this?
A couple of points. They should look at if there any type of family history, like diabetes is so common, cancer might be. That can be a consideration for one type of plan. Now, let me be clear. Let me be clear. With respect to Medicare, there is no issue about pre-existing conditions, because it doesn't matter your health. When you're turning 65, it doesn't matter your health. Now, if you go down to option one and you want to get a supplement that covers the 20% that Medicare doesn't cover, there's just a 6-month window where you can get that, and it's guaranteed without any health issues. But as a rule, when you're turning 65, it doesn't matter your health, but it could factor in if you want a supplement, if you want to go down option one. It doesn't matter for Medicare Advantage all in one. The only question they're allowed to ask is, do you have kidney disease? And if you do,
end-stage renal failure.
It's technically called end-stage renal kidney disease. And if you do, there's typically at least a special plan for that. That's the only question they're allowed to ask.
Sure, and I'm asking, what should a person be looking for? Because if a person has a certain ailment, is it possible that the things associated with that ailment are not covered under a certain plan?
It's unlikely with Medicare, but what is likely is that, particularly with, I find with cancer and stroke and heart attack issues, they're covered, but there could be a lot of extra expenses.
So you would want to pursue and find out if there was a copay or what amount is covered that you would have to pay out of your pocket or whatever.
Yeah, and a copay is the amount, typically the amount you pay as you go when you go visit a doctor or another healthcare provider. That's the copay. And the co-insurance is a percentage.
Okay.
But to make sure the audience knows, whatever your health is, when you first turn 65, it's not an issue in terms of you getting coverage. And in fact, you're guaranteed coverage regardless of your health.
Right, and I understand that. But to a person, 95% of the people that have this type of coverage is concerned about, what am I going to have to pay for it?
Okay.
So I'm trying to help them to say, when you look at the options that you put on the table, what should I be focusing on? Like if I had, I don't know, whatever, if I went to get this treatment for vascular screening, is it zero copay?
Okay.
You know what I mean?
Yeah, yeah. That's a good question because some, particularly what you're talking about, Part C Medicare Advantage.
Okay.
Those are network plans. A network is a group of doctors and providers. It's not everybody. It's that network for that plan.
They're all in agreement, so to speak.
Yeah. So if you have Medicare only, there will be some copays for some, depending on what you need.
Okay.
One of the most common ones is the cost for a specialist. Now, let me be clear. This is for people who have Medicare. For people who are dual eligible with Medicare and Medicaid, they won't have some of these costs.
Right.
But if they have Medicare, typically, and I run across this a lot, people have specialists, and typically the industry is going towards zero copays for your primary care physician. That's the trend now.
Yes.
But for specialists, it's not zero. Typically, it's $45, and a lot of people don't have that. That's the copay for their Medicare Advantage.
So I should be looking to determine whether it is not. Are there such things as where specialists there is a lesser or no copay? Is there such a thing as that?
Okay. To answer your question about what should they be looking for, my first thing is your doctor covered in that plan? That's the number one.
Sure.
If you have a regular doctor that you go to all the time, you don't want to get into a Anthem, Blue Cross Blue Shield, or whichever way you choose, and they don't accept, or they're not partnered with your doctor.
So you call that in their network?
You want them to be providers, and there's a category: your provider and your participant, or your non-provider and your non-participant.
Explain.
So provider means we're in an agreement together. So my doctor, I'm in a plan that has agreed to. My doctor can come. I can use that doctor. My doctor is in that plan.
Sure.
So I would look to make sure that my doctor was covered in that plan.
Okay. I
would next look to make sure that the medications that I'm taking is covered in that plan. And then I would also, that's for Medicare, the Medicare Advantage plan, which he's talking about, which is Part C.
Sure.
And it's almost, in my opinion, I normally try to see if I can help them find a Part C plan, because, like Robert said, it covers a whole lot of other issues that if they just had the Part A and B, they're still having to pay that extra 20%.
Sure.
Where, the company or the insurance pays 80%, but you're still held on with the 20% of having to be on your own.
Sure.
So those are the things. I make sure that the doctor was covered, then I make sure that the pharmacies are covered. And then you can also check for specialists to see if certain specialists, because even though they're a specialist, they might be participating specialists, where even though you might have to pay a copay of $40 for a specialist, if they were non-participating, you might have a copay of $80 or
you might have to pay the whole thing.
Or might have to pay the whole.
Is it possible to have a greater out-of-pocket payment where you don't have to pay $45 with like an annual deduction? What is it when they have?
See, the out-of-pocket, that's with the out-of-pocket does not run into the Medicare thing as much as it would in the marketplace.
Right. You said, is it possible not to have to pay that? Is that your question?
In other words, I know they have. Let's just go to regular insurance.
Okay.
You can have basic liability, and then you can have full coverage. Now, I'm going to pay a lot more for full coverage than I am for basic liability. Do these plans, of the coverage, as you're saying, have the option that you may enter this, but if you wanted to pay a little more money, it's going to cover a lot more?
Well, in some cases, not in Medicare Advantage. Medicare Advantage is popular with folks who don't want to pay a monthly premium, because that's one of the first, in addition to what Ms. Calhoun said about you want to know your doctors, your medication, your hospitals, people want to know, okay, how much is this going to cost me a month?
Sure.
So all these major companies, and I'm with a lot of them, a whole lot of them, they have what's called the zero premium plans.
Sure.
So many folks who don't want to bust their budget or who can't afford will opt for a zero, which is a Medicare Advantage plan that we've been talking about.
Sure.
So, and if it's a Medicare Advantage plan that's not a dual plan, dual means Medicaid and Medicare.
Yes.
They're going to have copays.
Yes.
Because Medicare Advantage is pay as you go. That's really how you can do it. Pay as you go. Whereas a Medicare supplement on the other option, you kind of paying in advance.
Sure. So in addition to that group of Medicare individuals, what about the ones who are able to pay more for more coverage?
Okay.
Because everyone is not in that category.
Right.
And I'm sorry, go ahead.
No, the ones who are able to pay it, they go with option one. Option one is they have, of course, A and B, your red, white, and blue card.
Okay.
They're willing to pay for a prescription drug card. Like I said, the average is $35 a month, but there's some that cost less. And they're able to pay a Medicare supplement, which covers the 20%, and those run from $100 to over $200, depending on which plans you get.
Okay.
Those plans have no network.
That's considered C, Part C? Part C.
No, that's not Part C. In Medicare Advantage is the same thing. That's just a supplement. So to answer your question, the people can afford that. They're willing to pay for all of these. Here again, they're going to pay for their Part B because they make too much money. The state's not going to pay that $135.50 at least.
Sure.
They're going to pick a prescription drug plan.
Sure.
And they're going to pay for a Medicare supplement.
Sure.
And basically, they're paying for things pretty much in advance.
Sure. But they should be looking for the type of coverage. For instance, procedures. If someone is planning on in the future, planning on a hip replacement, you know, it may not be at the moment, but they know in the future they're going to get. Shouldn't they be looking at something that could either assist them with that kind of procedure or covers that kind of procedure? And there are many, many procedures that can take place.
Yes, and unfortunately, hip and knee replacements are all too common, especially hips. So that's why whether you're in option one or option two, and I keep going back, I hope I'm not being too confusing.
You're not.
They can call you if they have any questions they can ask.
Right, because I do all this for my clients. They don't have to do anything. I do all the research for them. And but if they know they're going to have a hip procedure, it's a good question, because if they go in the hospital and they're admitted to the hospital, they're going to have the procedure is going to be covered, but they're going to have a copay, a daily copay. We're back to Medicare Advantage, and they may not be aware of this. Now, to be clear, their procedure is going to be covered, but they're going to have a copay.
Okay. And
typically, that copay is going to be about $300 a day.
Okay.
So there are plans called hospital indemnity plans.
Okay.
That's separate from Medicare. It's a different type of insurance plan that they can purchase. It's optional to cover that copay. Now,
and this is what I want to get to, so that people know. You should be looking for this, because if they're in that financial bracket and then they're not aware that they should, what is the name of the coverage again?
It's called a hospital indemnity plan.
Hospital indemnity.
Indemnity just means cash. So now if they know they're going to have hip surgery, and I run across this, I ask people to let me know far in advance, because you can't just jump into one and then, I'm talking about a hospital indemnity plan.
Sure, sure.
And then you have hip surgery the next month, you're still going to be hit with that copay.
Right.
You want to look 9 months a year ahead of time.
Right, and this is why we have these conversations, because if someone is looking at the show and they are trying to plan things around their health and making decisions where they're not run out of house and home, they know that these options are available. That's why I tell people to get a pencil and a piece of paper as we delved into these conversations about coverages and co-pays, and there are additional coverages that you can, am I saying the right word, Miss Plans?
Not plans.
Well, I'm responding to him because he said plans. That they can get to be able to protect them, where they may have to put some cash out, but not as much if you didn't have any type of insurance in that area.
Yeah, and then that opens up a whole nother conversation, because they have what is called a health savings accounts where some jobs and some people put money aside specifically for, I know I'm going to have to get some eyeglasses at the end of the year, so I can put money aside. That's called a health savings account. They have those.
So that's just like a savings account.
No, it's a health savings account. I'm glad you brought that up. This is through an employer.
Okay.
Typically, basically, it's like a healthcare retirement account that you can choose. You don't lose it. Typically, your employer will contribute to it at the beginning of the year, maybe $500 or $1,000. Sure. Because it has to have a high deductible health plan with it. So people can contribute that. They can put this year $3,500 for a single, married $7,000. They can build up a whole slew of cash to pay for things later. That's what helps.
Things that he was suggesting.
Of course, at $3,500, you'll be empty in your first treatment. I'm sorry, please continue.
But there's a point that I think we should have shared earlier in the conversation when we were talking about the 65-year age. There's a penalty, and you probably can expound more upon that, Robert, for individuals who are turning 65 who don't enroll in Medicare.
So let's bring the part. First of all, when you turn 65, you have to enroll in Medicare. Is that correct?
No, you don't.
But you can. You have to enroll, but you.
Well, what happens is about 3 months before you turn 65 again, Social Security is going to send you a red, white, and blue Medicare card.
Okay.
And that's going to be Part A and Part B, as we've been talking about. Now, some people make the mistake of, I understand why they do it, because they see that A is not going to, Social Security lets them know, okay, A is not going to cost them anything. And if their income is low, they see Part B is going to cost them $135.50. So they make the big mistake of turning down B. That means they have no coverage for doctors and providers, only if they actually in the hospital. And they do that because they don't know that if they apply for these programs, the state is going to pay for that Part B. So, we wind up re-enrolling them in Part B.
And I get that part. But in the onset, first of all, you're going to get a notice from Social Security. When you get the notice, be aware that decisions have to be made in reference to Part A, Part B, and Part D. Is that correct?
No, if you get the card and you don't turn down Part B, then you're going to be covered for A and B the first day of the month that you turn 65.
So, well, this is before they turn down anything. If they just got a card, they need to respond.
Well, if they want to keep the coverage, they don't have to respond. But they're going to have Medicare. They're going to get a red, white, and blue card for A and B, but it's going to start the first day of the month that they turn 65.
Okay.
That's why I tell people to start looking at this 6 to 9 months before you turn 65.
Sure, or even a year before you turn 65.
Yeah, I want to get back to what Ms. Calhoun was talking about because the penalties can apply if you're late. Turning 65, you can enroll 3 months before the month you turn 65, the month you turn 65, and 3 months after.
But what are you saying, enroll in what? You said
I'm sorry, you're enrolling in Medicare. You're actually enrolling in Medicare.
Okay, so here was the confusing part comes because I'm confused on this. You said once you turn 65, you're going to receive the blue and white card. That's not enrolling in Medicare.
Okay, yes it is, and I understand why it's a little confusing. It's because Medicare is good, but it's not enough. So if you just get the A and B card, you may think that you got everything covered. And remember, it doesn't include prescription drugs, and a lot of seniors on prescription drugs. So that's not covered. And it only covers, it doesn't cover it at 20%. About 67% of the people that go bankrupt is because of medical bill issues.
That's true. So I want to stay focused on the procedure. Once you get the blue and white card, it just comes with basic things. Those basic things are, and then once you have the basic, you need to go further by doing what?
Okay. If you had Medicaid, Medicaid will temporarily send you a prescription drug card. Will take a prescription drug card, but what you want to do is look at your options. This is when you want to find out, your doctor, find out if your doctor's in the network, because it's a different issue from before you turn 65. You got to find your doctors, your medications, your hospitals, your pharmacies. Your hospital might not be in the network.
Well, and this, like you mentioned, some of the things that we should cover. If you get a card, won't you automatically be assigned some type of company that you have it planned under, and that's the company you should check with to find out if your doctor's in that network?
Not if you were not on Medicaid. So let's assume you're not on Medicaid. You're turning 65. You got this card. Okay.
Wow.
Wow. Well, that makes them want to stay tuned.
Well, what we do want them to know is that stay tuned. The same bad time, same bad channel. Next month, October.
Exactly.
Robert Renfro will be our guest again, and he's going to be coming back with some information. There's some new things that are going to be coming out about Medicare. Medicare open enrollment for Part C, the Vantage Care plans, begins October the 15th up until December the 7th. So individuals who have the red, white, and blue card, Part A and Part B, and they want to get into a different managed care plan, which is the Part C, they can do that anytime between this open enrollment period of October the 15th through December the 7th for Medicare. Medicaid open enrollment will begin also October the 1st for individuals who have Medicaid and they want to get into their managed care plan, which is CareSource, Molina, Buckeye, Paramount, United Healthcare. They can do that. And then, of course, the Marketplace open enrollment begins in December for the year of 2020. So.
Wow, how awesome. And it's so important that people be aware, because if you're not pleased with the current choice you've made when it comes to the insurance, here's an opportunity to find out other coverages, other agencies that you could possibly go to during this open enrollment. I think you wanted to give some numbers as well.
Yeah, of course, for Ohio Medicaid, I gave that number before. That was 866-640-6446. That's Ohio Medicaid. They can assist you with renewing, re-enrolling, and answering some questions. Then we have the Medicare number, which is 800-633-4227, 800 Medicare. So it's 800-633-4227. And then, of course, Social Security. Their number is 800-772-1213, Social Security, 800-772-1213. And finally, healthcare.gov, which is the Marketplace. And that number is 800-318-2596. 800-318-2596. So we talked about Medicaid,
yes,
which is for low income primarily, or the age blind and disabled. We talked about Medicare, which is usually individuals that are 65 or older. The Social Security can be under people who have disability or they're 65. And then the Marketplace, of course, is individuals who are employed, but their jobs do not offer them adequate insurance, and they can go to the Marketplace and enroll and get assistance with paying for their premiums and also for their out-of-pocket expenses.
How awesome. I want to thank you, Ms. Calhoun, for coming on the show today. I tell you, it has been very interesting to go over the many, many, many areas that need to be covered when it comes to Medicare and Medicaid. I mean, open enrollment. I mean, this, oh my goodness, Marketplace. There's so much information. So again, thanking you for coming on the show. And again, we're talking about next month. We're going to expound on it when all this stuff comes into effect, to give more information, asking people to stay tuned for our next broadcast to get all the other extra information.
Can I say one other thing?
Yes.
I beg people, please don't change any plans until you've spoken to a professional. Make sure, because what is happening, as Robert expounded a little bit in that clip that we saw, the state pays a certain amount of money to these companies to get people enrolled. So they might call you and you might think that you're not giving them permission, but you really have, and they've changed you out of a plan that you might not be able to see your regular doctors. So don't sign, say yay or nay to anything until you've spoken to a professional, someone, and they're all over the city. All you need to do is Google. Google is the way to get information nowadays. And Google and ask for help with finding insurance, as simple as that. And they'll bring you local people in your area that can help you.
Wow. Thank you, thank you, thank you, thank you, thank you. We're going to change subject just a little bit. Looking forward to our next broadcast with more information for you guys that are dealing with Medicare or Medicaid or the marketplace. Oh, thank you, Ms. Calhoun. That's why it's good to have professionals on the program. They help people to remember all the pertinent stuff. But just want to let most of you guys know that the 100 Plus African American Men Chorus has open enrollment for this year's concert. Again, the concert is going to take place December the 8th at the Allen Temple AME Church, 7080 Reading Road. That's in Cincinnati, Ohio. For those of you that are not familiar with the 100 Plus African American Men's Chorus, it's a group of interdenominational men that have decided to take our young people at heart and do something to make a difference in their life by encouraging and supporting them to use the gifts and the talents that God has given them to be the best that they can be. The one-time annual concert, we have men from everywhere, as I just alluded to. The rehearsal is going to be at 6:30. Devote, which is the New Nazarene Baptist Church. You can Google that, 7 to 9 on every Monday. That's 6:30, Devote Avenue, New Nazarene Baptist Church. Rehearsals from 7 to 9 p.m. We do a wide range of music. You really want to be a part of this. Keep on talking, and thank you for joining us on these conversations with Let's Talk. I'm Henry Benefield, your host. Until later, keep talking.